My name is Keanu Baxter. My pronouns are they and them. I'm half black and half white. I'm 24 years old and currently hold a position as a health educator at the Public Health Institute. I've been working there for 2 years, as well as a long experience of volunteering with the community. It took me a really long time to get stable in the Bay Area, and with trying to survive came sex work and substance abuse with it. In that time, accessing things like healthcare, getting HIV tested, and PrEP, let alone sometimes getting a condom, was difficult. And in the sex working industry, if you use a condom, it means you don't make as much money. I didn't think my situation could get any worse, but it did, and I found myself getting caught in legal problems. I wasted about 1 year of my life dealing with it, and that's when I realized I was pretty much at rock bottom. At this time, I remember telling myself over and over again that I was tired of being tired and tired of fighting for the bare minimum. I decided to enter Walden House, where I spent a couple of months trying to find myself. And eventually, I learned to appreciate who I am. At that point, I finally got self-motivated to navigate medical and mental health care resources that I wasn't able to navigate before. I was able to get HIV tested, and I made it a part of my regular routine. It didn't stop there either. Slowly, I started finding myself within a circle of queer people of color that were positive and healthy for me to be around. I could tell that I was making healthy relationships. Through this healthy network of queer people of color and professionals, and my experience with navigating the system as a queer person of color myself, I felt that I was truly gifted the opportunity to work for the Public Health Institute. And now I get to help other folks going through some of the same struggles that I went through and impart knowledge and some of the skill that I gained navigating these things to people from my community so that they may have some hope. HIV testing, to me, is a way to keep myself healthy and also empower myself in navigating through life's ups and downs in the safest and most respectable way possible. Knowing what my status is, along with a deep understanding that being light-skinned comes with a privilege, instills a sense of duty for me to fight and speak out for Black trans women and Black and brown queer folks who come to PHI on a daily basis. They are the ones who are heavily impacted by the lack of access and discrimination in today's healthcare complex. Even though there are barriers that we, people of color, and folks with a lesser socioeconomic background continue to face up to date, HIV testing continues to be out there, and I hope to share its accessibility despite how difficult the world makes health and meeting our basic needs out to be.